Welcome to the Healing Grove podcast. I'm Dr. Kristen Ryman, an integrative holistic family physician, author of Life After Lyme, and host in this virtual space of learning, healing, and growing. I believe humans are like trees, and our physical limb is only one of many. Health on all limbs of the tree, emotional, conceptual, social, spiritual, is absolutely required for the whole tree that is you to be vibrantly well. I created the Healing Grove podcast as a place to showcase some of the world's best integrative and holistic medicine, to expose you to transformative tools and mindset shifts for all limbs of your tree. I hope you enjoy our conversation in the Healing Grove today as much as I enjoyed having it. Hey everyone, welcome back to the Healing Grove podcast. I'm still Kristen Ryman, your host, and I am so delighted today to introduce you to my friend Scott Marsland. So let me give a little background bio on you, Scott, and then I'm going to let you tell your story.
Okay.
So Scott Marsland is a family nurse practitioner with over 25 years of clinical experience in healthcare, including primary care, emergency medicine, and also public health and corrections. And I kind of want to hear a little bit about that if we have enough time. He earned his Master's of Science in Nursing from SUNY Upstate Medical University, graduating Magna Cum Laude, and has been board certified as a family nurse practitioner since 2014. Since 2022, he served as co-owner and practice partner with Dr. Pierre Kory at the Leading Edge Clinic, which is a telehealth practice specializing in complex chronic conditions such as long COVID, post-vaccine injury, and adjunctive cancer care. He's also the co-owner of, and I don't know how to pronounce it, is it Asao? Asao Group, which produces Aurmina, which is a delightful beverage, which I'm actually drinking right now. We'll maybe get into that too, because that's an exciting piece of what's going on over there at Leading Edge. And it's an innovative mineral-based water purification product, in case you guys want the little teaser. So Scott, you're known for your integrative evidence-based approach. I've sent patients to you, but you also share clinical insights through your Substack, which is kind of how I first really got turned on to what you're doing over there, and really just so excited to meet you. So that Substack is called Lightning Bug. We'll definitely link to it in the show notes, because I think all of you guys who are listening to my podcast on a regular basis will benefit from what he's sharing over there. In particular about the out-of-the-box things that you're using and have kind of repurposed and discovered through your journey through long COVID yourself and as a clinician. So I'm gonna turn it over to you, because I think you have an incredible story to share, and as many people who come on this podcast do, they've sort of lived through the hard things themselves and come away with some deep, profound learnings. And so let's just start there.
Well, thanks for the lovely introduction. Glad to be here, Kristen. I think the snapshot I would give to you and your patients and people who are watching this is how did I come to be in the place that I'm in right now? I was born with heart disease, hypertrophic cardiomyopathy, or HOCM, and I'm in my mid 50s, and when I was a kid, there were only a few places in the world that had expertise in that surgery, and one of them was the National Institutes of Health. And so I ended up being a patient there and having heart surgery there at the young age of 15. And I met these deeply inspiring people that, everyone from the food service to the housekeepers to the nurses to the physicians. It was a special time, I think, in medicine. They were deeply committed, very human people, engaged in research. The nurses were all master's educated, working on their PhDs, but providing bedside care. And it planted the seed for me to end up in healthcare, to end up becoming a nurse and then end up doing research. And it also, I came from a broken home. I came from a home of alcoholism and abuse, and that time in the hospital back then, these days you have heart surgery and they're kicking you out the door the next day. Back then, I was in the hospital for 3 weeks. I was in the ICU for a day because I had a pneumothorax. One of my lungs collapsed, which was the most pain I've ever experienced before or since in my entire life. And the loving attention that I received when I was there in the hospital as a patient transformed my life. It really, it gave me an opportunity to reevaluate how I saw myself and come out of that experience, even though it was physically painful, emotionally scary. I had to contemplate my mortality at a young age. Um, and I still bear the scars to today. It was a transformative experience, right? And and I believe that part of what makes me an above average clinician is that I know what it is like to have someone try to start an IV on you after 6 attempts, and I know what it's like to be in terrible pain and not be able to communicate that because you've got a tube down your throat. And I know what it's like to be on medications that give you side effects. And I know what it's like to be talked down to by clinicians. And um, I am by no means immune to the faults that we can have as clinicians, but I think I'm able to compensate to some degree because of my own lived experience. So fast forward to 2019, I was working as an emergency nurse in a level one trauma center at SUNY Upstate Medical University, and uh, it was really a highlight of my career. I was not. I looked at the 20 somethings around me who I thought were like trauma junkies, and they just couldn't wait to get into the trauma room, and I just bided my time. I had been in emergency medicine since 2007. And I'm generally calm, cool, and collected when the shit hits the fan. And uh, I thought, well, sooner or later, the higher ups are going to be like, well, how come Scott hasn't been trained into trauma? And eventually that happened, right? Enough of and the 20-year-olds would do stupid stuff like they would post pictures of themselves and patients on Facebook and they'd be gone because they violated HIPAA. It was just kind of crazy stuff. So I ended up in the trauma center, in the trauma room, and it felt good. I felt like I was a good person to be there. In when you study CPR, they talk about closed loop communication. It's like I'm going to push epi right now, and someone else says we're pushing epi right now, or like okay, we've done compressions for 2 minutes, time to check a pulse. So, okay, we've done. It's just like I'm that guy, right? And not that long after I started working in the trauma room, one of the very experienced trauma surgeons is very intimidating. Of course, they can be. He just very is. I was so touched, right? Like he just grabbed my sleeve and took me to his side. He's just like I just got to say, I really like your style. I'm really glad you're here. You're a calm presence. Things always go better when you're here. I'm just like, yeah, yeah, man. Like I don't need another attaboy for a year. Like that takes care of
Yeah.
me. And so then I want to say it was February of 2020. I was working a shift. We worked 12-hour shifts. And in the middle, and I was a trauma nurse that day, one of the two trauma nurses. And in the middle of that shift, my body changed. I started to feel chills. I felt nauseous. Um, I just felt sick. And I went to the charge nurse and I said, you know what? I need to go home. And at first she laughed like, "Oh, that's funny." And then I was like, "No, I need to leave now because I have an hour and a half to drive home and I'm sick as shit and I'm if I don't leave now, I'm not going to get home." And she was like, "You can't do that. You're one of the two trauma nurses save on." I was just like, "I don't know I'm not sure what you got to do, but there's a lot of people here and I got to get home." And I went home and I was in bed for like a week. I
Mhm.
one of the sickest. It's like not the sickest I've ever been, but I was really sick. And in retrospect, I think I got COVID because we saw a lot of international patients and including patients from China. And And I want to wrap this up because I don't want to spend too much time on this, but there is a guy named, his last name's Thomas. I think it's Dr. Stephen Thomas. Um, he was one of the co-authors on the New England Journal of Medicine article talking about the Pfizer vaccine and the Pfizer trial. It had 44,000 people, right? 22,000 in the control group, 22,000 in the experimental group that got the vaccines. They infamously unblinded the study, gave it to everybody, right? And so he worked at SUNY Upstate. And I'll just simply say I really, really came to dislike that man because when the pandemic became announced to the world, he started showing up rounding every day, telling us what we should and shouldn't do. And one of the one of the things that happened at the very beginning of the pandemic was before the WHO had announced it, I think it was like March 15th, somewhere around there.
In March, yeah.
Yep. We used to, we're emergency nurses. We're smart. We were talking to each other. We're like, we should start wearing N95s. And we did. And that day, the manager came around. She's like, "You can't wear N95s. You're going to scare all the patients." Da, 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 da. And we were just like, "That's crazy, right?" Guess what she did the next day?
Mandated the N95s.
You need to wear your N95s. If you don't wear your N95s, and right then, I knew the gig was up for me. I was like, "This is I've never seen anything like this in my entire career. This is crazy, right?" The other thing is, they started telling us you need to reuse your N95s, and uh, I was like 20 years of teaching out the window. I'm like,
That
this
makes
thing's
sense.
always been like disposable, wear it for 15 minutes. And then they said, oh yeah, and not only do you wear the whole thing for a 12-hour shift, but you can wear for 3 12-hour shifts. And when you're done, you're going to put it in a bag with your name tag on it, and we're going to clean it and give it back to you. And I'm just like, I got alarm bells going off left and right. And I'm a union steward, by the way, a statewide elected union leader. So I'm like, workplace rights, what, right? The first mask I ever got back had pink lipstick on it. Do I Do I look like I wear? I'm not a pink. I think I would
Looks
be
like
like a
you've given up wearing
sparkly.
your pink lipstick. I
Yeah,
don't see
I'd
that
be like a
often.
sparkly silver guy, you know?
Yeah.
And I was like, done, ain't doing it, right? So then to wrap that up with a cherry on the sundae, I have always been I've always thought that vaccines were safe and effective. I had every vaccine. I always got the flu shot every year. I had my meningococc, uh, meningitis series, and I was one of the first in line to get the COVID shot. And ultimately, I got the worst COVID shot ever. Like if you look at the death and disability data on shots, like my Pfizer was number one. I'm number one in something.
Okay, so let me pause you there for 1 second, and we're going to get into what happened to you. But I think at this point, some people will need an explanation of what do you mean the worst? Like, weren't they all the same? What do you say to that?
Meaning weren't all the shots the same?
Yeah, like
Yeah,
within the Pfizer, within the
yeah,
Moderna, like weren't within,
yeah.
like, what do you mean by the worst?
So there were bad batches. And without even going into why that is or where the bad batches ended up, I'll say you can look at the CDC's own data until they stopped collecting the data. They started hiding the data. But VAERS, Vaccine Adverse Event Reporting System, is where the CDC would collect data about vaccines that were administered. Um, and there's a website. I'm going to have a brain fart about what it's
I
got.
think
I
it's
think it's,
howbad.info.
yeah, how bad was my shot or
Yeah, how bad is
something
my
like that.
batch or how
How
bad
bad
dot.
is my batch? And whoever the people are behind that have done a tremendous service for humanity. But you can go to that and you can see did I get if you got a Pfizer or you got a mRNA vaccine or you got a J&J, if you were overseas, if you got AstraZeneca, and you can look up your batch. And it will tell you based on, like if it was in England, it would be based on a different data collection system. Here in the United States, it's VAERS, and it will tell you how many people died, how many people had disability, um, death, disability, forget what else is in there. I mean, isn't that happy enough?
Yeah,
Um,
yeah, yeah. And you have to have your lot number, just to be clear. Like you need from your card, it'll have your lot number.
yeah.
It's not just whether it was Moderna or Pfizer. You have to get the actual lot because there's differences within the same maker.
And you can ask, I've had a lot of conversations with patients about bad batches. When I've seen patients, not everyone in our practice does this, but it's my practice that when I see a patient for a vaccine injury visit, I ask them for their batch numbers. And I'll tell you that in 4+ years of doing this, that 99% of the people I've seen who are vaccine injured received at least one bad batch.
Yeah. Yeah, it's illuminating. I mean, it's a little bit of a bias, right? Because the people who are coming to us are coming with illness, usually after some of these
Right,
symptoms.
confirmation bias. Yeah.
Confirmation, yeah, thank you. Well, so yeah, that's a whole other place we don't need to get more deeper into, but people now have some information to be able to go look their batch up, et cetera. Tell us what happened to you.
Well, whenever I try to make something funny, I'll just say, in third grade I was the class clown. Okay, so it's not that I have gallows humor. That's part of how I survived in the emergency setting for 14 years.
Yeah,
So I just want to preface it, right? When I try to make jokes about these things, it's not because I don't take them seriously. It's because I want to be able to laugh about them. So uh, I got two bad batch shots in 2021, January and February of 2021, both Pfizer's. Um, and I had even started caring for people with long haul and vaccine injury in February 2022 when we opened up the leading edge clinic. It probably wasn't until the spring of 2022. My lovely beloved wife Carrie, who I've been together with for 33 years, she comes from a family of mumble mouths. And and I kept saying, "Well, you are mumbling so much, I can't understand what you're saying. Will you please articulate?" And she's like, "I think you're getting hard of hearing." And I was like, "Well, I'll tell you what, I'm gonna set up an audiology visit and I'll show you my hearing's just fine." So I did, and the audiologist came out of the booth and she said, "Mr. Marsland, you qualify for hearing aids. I'm going to write the referral." I didn't hear anything else that she said after that. I was like, "Are you kidding me?" And then she showed me the graph. I was like, "Oh my God, hearing aids." So I was stunned, and that really that really opened up my eyes. So I began inventorying, like, well, what else is going on with me, right? Um, yeah, my Bubba, my mama's mom from Czechoslovakia used to call it the organ recital. Like head to toe, all the things that are wrong with you, right? I'll tell you the other kind of bookend to my experience was, I'm a heart patient, right? But I'm a special heart patient, right? I'm not the old guy with the legs swelling. Like
right. You
I
haven't been
run
smoking your
around.
whole life, and
No,
yeah,
nobody knows I'm a heart patient, right? Um, and I went for my semi-annual echocardiography, and I got a call from the nurse, unlike any call I've ever gotten before. She was like so serious. So she's like, "Mr. Marsland, Dr. Mauser," my cardiologist, she's like, who I've known for 25 years. She's like, Mr. Marsland, Dr. Mauser, he needs to talk to you about your echocardiogram. Are you available this afternoon? And I was like, uh-oh. Sure, right? Um, and so he calls me, and after the niceties, how are the kids? How are the cats? He's like, "Well, Scott, I need to refer you to the heart failure clinic in Rochester. And I'm like, what? It's like, yeah, your ejection fraction has decreased to 40%. Now, what's ejection fraction, right? The left ventricle of the heart pumps out arterial blood. It doesn't completely empty, right? I mean, normal ejection fraction is like 55 to 65%. I'll say upwards of 60 is good of the blood that's in the left ventricle every time the heart beats. My ejection fraction has always been 65% or above, even though I have heart disease, right? So essentially, my heart was damaged. And in a way that happened without me consciously knowing that, right? And again, it's just like I heard the beginning and I kind of zoned out, but I heard the cardiologist say, yeah, I want you to start these 4 different medications. You need to go to the heart failure clinic, need to do this, need to do that. We may need to change. Da, da, da. I was like, holy shit, right? And then what happened when I reflected on that, I was like, oh, like I'm doing telemedicine visits just like where you and I are talking now, and I couldn't complete a sentence. I'd say a sentence, and I'd take a breath, and I'd say a sentence, like I had become short of breath. So obviously you can hear me, I'm a motor mouth right now. Obviously I'm not in the state I was,
Yeah,
right? But 2 bookends.
yeah. Wow. So do you have, I'm just curious about whether you think that came from the shot or you have evidence it came from the shot versus the COVID that you had in February of 2020.
Do you know what? It's as my friend David Kraskow would say, yes, Scott, that is a question. And I'd be like, you know, um, we'll never, I don't think we'll ever know. Uh, I believe that it was the shots, right? I had uh I had an echocardiogram before I had COVID, and I had an echocardiogram after I had the shots.
Mhm.
Those 2 things happened in between. Um, why would I say the shots and not the COVID? Um,
Well, you mentioned the shortness of breath, right? Was that happening
yeah,
prior to the shots?
so after I had acute COVID and I was really, really sick for a week,
Yeah.
I came back and I continued to work at the full pace of a trauma nurse in a level 1 trauma center for until August of 2021. I was in rooms. I was wearing N95 masks for 12, 13 hours. I was encased in plastic, sweating my patukas off. Um, there was not any loss of stamina. My wife and I weren't arguing about my hearing loss.
Mhm.
My partner Pierre would say temporal association.
Mhm.
Um,
Yeah. I mean, it sounds that way. Other than, so as you were going through this kind of, this whole full organ,
the organ
kind of
recital.
organ recital, did you find anything else besides the ears and the heart? I mean, that would be enough, but did you find anything else?
Uh, Yeah, I mean, I would say, like, I see myself in this telemedicine. Like, people always thought I was like a boy. They always thought I was like 10, 15 years younger than my stated age. And I could see my skin lose its collagen. I could see the wrinkles coming in. I developed floaters in my right eye. I don't know if you can hear the hoarseness in my voice, but this is what happens like after standing in front of a computer over the course of the day. Like the EMF actually affects me. I My mast cells are activated. Like the tea that I used to drink and enjoy, the black tea, the pu'er tea, the fermented tea, I can't drink it anymore. I used to eat a banana every day, which has got a ton of histamine. Can't eat, had to give up bananas, right? Because I'd be talking like this, right? And um, I I began to have palpitations. I developed post-exertional malaise I would come home after I used to be able to do a 12-hour shift standing on my head and come home and go out and garden or do whatever, right? I'd come home from work and I'd be like this,
Hmm.
like trying to stay awake. Um, I'm a skinny guy. But I was like 120 pounds for like 30 years. And I just lost my appetite. I used to be on a seafood diet. I'd seafood, I'd eat it. I could eat all day long, right? And my metabolism, I just burned through it. I'd never get fat. I dropped down to 105 pounds. I looked like an Auschwitz victim.
Wow.
I had to force myself to eat, right? And I developed pain in my legs, numbness and tingling in my left foot, toes, um, tinnitus, which is still with me, bilateral. Probably the worst because to me, the sexiest thing in the world is intelligence. I started to have, I joke with patients, I'd forget my left ass cheek if it wasn't attached. Like I started to have cognitive issues. Like I still have names in particular. Like I see my neighbor who I've known for 25 years. I'm like, what is this name? Right. Um, yeah, I'm sure I'm leaving things out, but that's yeah.
Wow. Wow. It's hard to imagine that because not because that's rare now, right? So many people are struggling in so many ways. But it's hard to imagine because you were also on the front lines of clinicians caring for people with all these symptoms.
Yeah.
Who was taking care of you through all this?
Well, India Scott is a nurse practitioner who you know from our provider meetings who I met carrying, she's in Pensacola, Florida, and was working in primary care, and I met her caring together for a pro bono patient. And I was so impressed with her, I recruited her to come work with us at the Leading Edge Clinic. And she's amazing. And so when I did realize that I was vaccine injured too, I became a patient of hers, and I would not be honest if I said I'm still an active patient of hers because I've really even of all my complaints, I'm so much more functional than I was 2 years ago. And but I knew enough as a clinician, like I need another person's mind in here thinking with me, right? And India helped fill that role.
Beautiful. I always talk about the importance of your healing team, and it sounds like you had a really awesome partner, at least in India. Um, so one of the things I've heard you said in the practitioner meetings that you just referenced is that the Juvent device changed your life. And I'm thinking about now the story I've just heard for the first time, and just in terms of how bad you were, how awful your symptoms were. Do you feel like that made a dent there? And would you be willing to talk to us about that?
Yeah. Um, well, yes, and to talk about the Juvent, there's a couple other things I can think of, right? In my blood, I have amyloid fibrin microclotting as measured by testing that Dr. Jordan Vaughn does in Birmingham, Alabama. And on a scale of 0 to 4, 4 being the worst, I was a 3.5. And I developed swelling in my legs, which in medicine we call edema, lower extremity edema, pitting, lower extremity edema. Um, and before the pandemic, I always had pancytopenia. I always had low platelets, low red blood cells, and low white blood cells. And that was just kind of where I lived, right? And I had been to a hematologist multiple times, and she finally was like, "Stop coming. You're fine. This is where you live," right? Um, when I learned about the Juvent because my partner Pierre was neighbors with Peter Simonson, who owns Juvent, and I uh, I think a patient talked to me about it. And I texted Pierre and I was like, "Hey, you know the guy that makes these things? Like, can I get a discount?" Like, can I get a friends and family discount? And so I did, and Peter helped me get one, which is a big deal because it's a $6,000 device. And for what it's worth, like I've always been a person of modest means. Like the car that I drive costs less than the Juvent. Okay.
But it
And
has less impact on your bone marrow, I'm going to put out there.
correct. Also correct, right? And so if you look at the device, I would describe it, it looks like a really big scale, right? It's like that big. And and it's a vibrating platform, right? It's a micro vibrating platform. And when you stand on it, I could talk to you and you wouldn't hear the vibration in my voice necessarily, but you feel it. And what before we go into like what it does and how it does it, I'll tell you that the changes that I experienced by using the Juvent for at first 10 minutes a day, then 20 minutes a day. The thing that I noticed first was that the aches and pains that I had been developing began to decrease. And then I noticed that the pitting swelling in my legs began to improve. So that there's still swelling today, there's still swelling, but it's no longer pitting, meaning you put your finger on and make an imprint in it and take it away and it stays. It's no longer like that. And then about a month after I started using the Juvent, I had blood work for an annual exam, and it came back. And for the first time in 20 years, my red blood cell, white blood cell, and platelet count were all normal. Yeah, yeah. Um,
Did you even see that coming? Like, did you think that was going to be part of it, or you were just getting routine labs?
I was just getting routine labs.
Wow.
Um, and then what else can I say about it? I, th- it's hard to remember the how severe the post-exertional malaise was that I had. Um, but I think that the Juvent is one of the tools that helped me move out of that. And also, um, I can feel my muscle tone. Like part of what the Juvent is doing is it's stimulating bone and muscle. And at a time when I didn't I didn't have the capacity for vigorous exercise. I still don't, but it was hard for me to go for walks. It helped maintain musculoskeletal strength and actually helped to a degree rebuild it. Um, and you know, so I had my experience with it early. Um, and I also had the good fortune of getting to spend 2 hours in a long, detailed phone conversation with Peter Simonson, one of the owners of it. And what I came to understand and appreciate very early on was there is no there is no field in medicine that quite covers this aspect of bones, right? There's orthopedic surgeons that I think of like as the rough carpenters of medicine.
Mhm.
And there's endocrinologists, right, that treat our diabetes and our thyroid disease, but there isn't really anybody who you go to. Well, and then there's hematologists, oncologists, right? There's hematologists that study blood disorders in relation to bone marrow, but there isn't really anyone that puts all that together. There isn't
Mhm.
really anyone who says, bones are a lot more than what we hang the meat suit on. They're a lot more than what makes red blood cells, white blood cells, and platelets. Like actually, bone is a metabolic organ. Bone is an endocrine organ. Bone is an immunologic organ. And in fact, bone is intelligent. And, we can have an argument like who's in charge, the rectum or the brain or the heart or whatever. Like I think bones may actually be calling the shots. And what is happening when you're standing on that vibrating platform is engaging bone around all of those things. Let me stop for a second, see if I'm going where you want me to
It's
go.
just fascinating. And I'm thinking about how you describe this in your, you have it. So back to the Substack, which I think, again, everyone needs to go to and check out. But you had a great article there on the Juvent. You share a video there, which is, I think, helpful with Peter Simonson being interviewed by Dr. Gundry, talking about this metabolic role of bone. And it's just so interesting. It gets me thinking about, like, I'm trained in I would say I dabble in Chinese medicine because I did the Helms course for medical acupuncturists, which is a 300-hour CME. And
Wow.
I have some background in that. So I'm always interested in reminding myself of, oh yeah, so what did like the Yellow Emperor, what does his like internal medicine, text say about what bone's role is? And the bones are related to the kidney. I remember that. And the kidney is sort of stores the essential life force, right? So it's not surprising to think about the bones as playing this much larger role than we sort of traditionally think about. So you said something that I wanted to get back to, which is you said this is not in the Juvent article, but you'd written something about recently about COVID spike protein, and I loved what you said there about a good hypothesis acting as a flashlight. And I'm thinking about that because I know you have so many out of the box and brilliant kind of treatment protocols that you guys are using at leading edge, and Juvent is just one of the things we've talked about there. But I'm wondering if you're willing to share some of the other things that the flashlight hypotheses, right, that you've come across and been studying, researching really, especially through COVID, have kind of illuminated for you.
Well, the first one that comes to mind is actually Sulodexide. And I feel a little badly talking about it because it can be so hard to get. Um, but I think it's instructive, right? So Sulodexide is a medication that was developed and approved in Europe. It's a low molecular weight heparin. So any clinicians that are watching this, like, Lovenox is a low molecular weight heparin that's safe in pregnancy. And what is different about Sulodexide is that it's actually a multi-talented therapy. Like, it's antithrombotic, it inhibits platelet activation, it heals the endothelium, it's anti-atherosclerotic, and did I say already inhibits platelets?
Mm-hmm.
So antithrombotic, endothelial, anti-atherosclerotic, antiplatelet, I mean,
Fibrinolytic.
fibrinolytic. Thank you. Probably the most important. So it's safer than aspirin. And in the context of injury from the spike protein, almost all of those things come into play. And, it's made in Italy. If someone goes on vacation in Italy, they could take an American provider's prescription, they can get it. We've had patients who've ordered it online from Russia. We've had patients take a red-eye flight to Mexico to get it. Not all the European countries have it. They don't have in Canada or England. But the reason I bring it up is because I've had several patients who've run out of it. And what I tell patients is when we do trials of therapy, and the times that you can tell most whether something's going to help are when you start it and when you stop it. And in this case, it's just kind of hitting me upside the head with a 2x4 in the last week that I've had several patients who've run out of it and a cascade of symptoms have come back, right? So things that are impacted by the abnormal blood clotting, cognitive function, breathing, heart rhythm, having a normal heart rhythm as opposed to having 8,000 PACs on a Holter monitor, digestion, appetite, musculoskeletal function, joint pain, tinnitus. Like, I mean, it kind of makes sense, right?
Yeah.
Um, so I'll just kind of leave a footnote there. I'll say, if you go to my Substack and you search Sulodexide, I've written about it several times.
Have you seen people whose, DEXA scans improve, whose osteoporosis goes to osteopenia, goes to normal bone with any of these things or with some combination? Like, have you witnessed that?
S- I have a great story about the Juvent. Um, there was this lovely patient who he has since passed, who is in his early 80s, and he was married to a woman 10 years younger. And they bought the Juvent for him. But she used it intermittently, like literally in a month, she used it maybe 12 times. And the FDA approved use of the Juvent is reversal of osteopenia and osteoporosis. So it just so happened that the timing was that they got the Juvent, the patient was using it every day, his wife was using it intermittently, and then she had her annual DEXA scan after that month. And she went to her primary doctor, and it wasn't a proud moment. The doctor yelled at the nurse, saying, "You brought me the wrong studies, you idiot." Right? Like, go get me the right chart. And then the nurse, at first, she was like, cowed. And then she came back and she was indignant. She was like, "You shouldn't be talking to me that way in front of a patient. And I had the right study." And I was like, oh my goodness. She's like, I'll come back later after you guys sort it out. But then his like jaws on the floor, and he's like, I don't understand. Like you're like in your early 70s, and this is what your DEXA scan said like 2 years ago, and you look like you got the bones of a 30-year-old. What are you doing? He was just astounded, right? And I
Bones
am.
aren't supposed to do that. Bones aren't supposed to get better.
And I think to make it even richer, he was all queued up to have a conversation with her about starting biphosphonates, right? For her advancing.
You had to really go back to the old drawing board then,
Yeah, yeah.
rethink that plan.
As far as the Aurmina and bone remineralization, um, I think the best examples, plural, I have to do with teeth and jaw, right? Because I can't count now how many times I've had patients who started using the Ormina, and they went to the dentist, and the dentist is like, "Oh wow, like what are you doing differently? Like you got no tartar, you get a gold star this time." Or um, they had some instability. They were thinking they had to do an implant, or they did an implant and it took really quickly. Like just a level of health and repair that in that microcosm of the mouth, like was noteworthy. It elicited. It always strikes me. In general, I don't think most of our clinical colleagues are that curious. I think that's part of what makes us unusual. So I'm always really tickled when someone who I think is just kind of has their head down and they're doing the rote thing, their head pops up and they're like, "What happened?" And they start asking questions. Like I'm like, "Oh, that's really cool."
That
You
is
know?
cool. That is cool.
Yeah.
Awesome. Is there anyone for any of these treatment modalities who shouldn't be using them? Like it seems like everyone should really be drinking Armina and maybe sitting on a Juvent. How about the Sulodexide? Like, are there contraindications to these things?
Well, Sulodexide is a prescription medication. I mean, you can get it by hook or by crook, but it is an anticoagulant medication, and really you should be under medical supervision if you're taking it. That said, uh, legitimately, like looking at the safety data since 1972, it is safer than aspirin. The bleeding risk is less than aspirin, right? It's derived from pig mucosa or porcine mucosa. So if you have a particular
Pork
faith
allergy.
or a pork allergy, like that may not make sense. Um, with the Juvent, I'm not aware of contraindications. What I would say is that my dear friend Anthony, who has since passed in his mid 70s, he was using it for his decades-long martial arts injuries, and he would get a headache after using it for more than 10 minutes. So he would use it for a little bit less. So there is some variation in individual response. On the other hand, knee pain that he'd had for more than a decade, which could be as bad as 8 out of 10, was reduced to like a 3 or a 2 out of 10 after a period of weeks. So you might not you might venture a little bit to make it happen. As far as Aurmina, you know, we see a very particular population of people, right? Long haul vaccine injury, adjunctive cancer patients, complex chronic conditions. And so when I say that our patients are delicate flowers, I say that with love and kindness because I'm a delicate flower myself. And so if anybody's going to have a negative reaction to it, it's going to be our patients. And there have been patients who quite literally couldn't tolerate a drop of it in a gallon of water, right? And I honestly haven't yet, I have ideas, but I haven't yet figured out why that would be.
Mhm.
Um, uh, there have been these outliers. There have been patients who couldn't tolerate the treated water where you add a teaspoon to a gallon of water, but they could do the weight-based doses where they added like 1 milliliter per 20 pounds. So if someone like me, it's like 6 milliliters
Mhm.
to a glass of water and just chugged it down and they did fine with it. Um, what I can say from the study, the toxic metal study, is that we did 24-hour urine collection on those patients, and once people started using in that case, we used Audio Clarity, which is a different brand, but a similar formula to Aurmina. Um, that once people started using it, people that had a really heavy burden of toxic metals, like out of like a panel of 20 things, they had like 15,
Mhm.
including things like uranium and gadolinium if they'd had MRIs. Um, that we did have to slow things down a little bit for some people to give the body a chance to catch up.
Mhm.
Um, So, uh, so for to recap that, what I would say is like um, using that kind of a therapy to treat your water is something that most people will be fine with. Doing the weight-based dosing, which we did, that's medically supervised care that's individualized, and we're looking at other things in the background to try and guide what we're doing.
Yeah, appreciate that. Well, awesome. Thank you so much for walking us through these new ideas for many people. I know there'll be new ideas and your experiences with them. Do you feel like there's anything we've missed? Is there anything else you wanted to communicate to this audience of delicate flowers, many of them, and hurt people who are looking and seeking answers for whole body and whole mind health?
What I want to say is that uh, after more than 30 years in the medical field, that I have never felt more hopeful about our capacity to help people heal mind, body, soul from the injuries that we have suffered. And that goes for everything from stage 4 metastatic disease to dementia to abnormal clotting to vaccine injury. And uh, there are there's not a cure for everybody, but in our clinical experience over the last 4 years, um, we have been able to help most people sooner or later. Um, and we've certainly been able to dramatically reduce the amount of suffering that people experience. And so I think similar to you, Kristen, like there's a heavy lift for me as a clinician, helping to care for people who have complex chronic conditions, even as I have my own. But I also keep learning, including through contact with colleagues like you, tools that enable us to do that lift.
Yeah.
So that's
Yeah.
what I'm saying.
Life is a team sport, whether you're healing or learning together. It's really a blessing to know you and to be in your circle. And thank you so much for sharing your time and your thoughts and wisdom with us, Scott.
It's been a pleasure and an honor to be here. Thank you, Kristen.
I hope you enjoyed this episode of the Healing Grove podcast. If you liked it, please be sure to like and subscribe. And if you want to deepen your experience further, consider grabbing a copy of the Healing Grove Playbook. With journal prompts for this podcast and 41 others, it's the perfect place to record your learnings, keep track of the tools you explore, and reflect on your own experience. Finally, it's important to mention that even though I am a doctor, nothing you hear on this podcast, whether from myself or my guests, constitutes medical advice. Any intervention you try should always be discussed with and supervised by a trusted member of your own healing team. Thanks for listening, and see you next time in the Healing Grove.